Hi, welcome to our 11th lunchtime fall prevention talk. On Friday, we had Dr. Andrea Iaboni talk to us about depression and fall risk. Did you realize that 1 out of 2 older adults with depression will fall this year? If you want to learn more, you can watch her talk on YouTube. Today, we have Dr. Avril Mansfield joining us. She is a scientist here and also a registered kinesiologist. She'll be talking to us about exercise and fall prevention.
Thanks, Christiane. So I'm sure that you've all heard that exercise is good for you, right? That exercise can reduce your risk of having cancer or heart disease or various other health conditions. But of course, exercise also helps to prevent falls. I wouldn't be here right now if that wasn't the case. So what I'm going to talk to you about today is what the research says about why exercise prevents falls. And I'm going to also give you some tips about how you can design your own exercise program to reduce your risk for falling. So there are 3 main reasons that exercise prevents falls. One is that it improves your balance. So impaired balance is the #1 risk factor for falling. And exercise, particularly exercise that challenges your balance, is the only way that you can improve your balance control. So we'll talk more about that later. Exercise also improves your general health, and you've probably heard this through many of the other talks that have been going on during this month, that the healthier you are overall, the less likely you are to fall. Specifically, exercise reduces the risk of having strokes or diabetes, which are specifically related to increased risk for falls. And also, a lot of the falls prevention strategies that we talk about this month only really reduce the risk of falling. So we can't necessarily prevent every single fall. But if you do fall and you're physically active, you will reduce your risk of experiencing an injury. And the main way that this happens is by increasing bone strength and bone mineral density so that you won't fracture a bone if you fall. So before I talk too much about how you can design your exercise program to prevent falls, I have to do a little bit of a disclaimer. So first of all, if you have a certain medical condition, you might want to talk to your doctor before you become more physically active. So in the description for the YouTube video, and we also have some of these questionnaires here, there's a questionnaire that you should fill out to assess whether you should talk to your doctor before you change your physical activity level. So fill out that questionnaire and follow the recommendations. Even if your doctor does suggest that, or even if the questionnaire suggests that you should talk to your doctor, it doesn't necessarily mean that you should not exercise at all. It just might mean that your doctor suggests you avoid certain activities, or that you avoid exercising too hard. The other thing is that exercise. So when you do exercise, it's important to listen to your body to prevent yourself from experiencing an injury. Exercise shouldn't cause any pain. So people say no pain, no gain. That's not true. While you're doing the exercise, you should not experience any pain. If you do have pain, particularly chest pain or dizziness, stop what you're doing and perhaps also consult your doctor. It's normal to have some muscle pain the day or 2 after you exercise, particularly if you do something new. So this should go away after a couple of days. Don't worry about that too much. If you do feel sick or you have an injury, take a break from your exercise routine. Don't try to keep going if you feel ill, and just get back to it whenever you feel better. So listen to your body is important. Before I talk to you too much about how to exercise, I'll shamelessly plug my own research study. So we're recruiting people who've had stroke for a study on exercise and falls prevention. Again, in the description for the YouTube video, and we have some information here about the study. If you're interested, you can come talk to me at the end of the talk. So when we design exercise programs, there are 4 things that we think about, and we have this nice acronym FIT to design exercise programs. So we talk about the frequency, intensity, time, and type of exercise. So the first thing I'll talk about is type of exercise. The #1 rule when it comes to type is that you do something that you enjoy. Everybody has, when you were a kid, you play soccer in the playground, maybe you really enjoyed that, and you kind of lose that enjoyment of exercise as you get older. But it's important to find something that you enjoy, because if you don't enjoy it, you're not going to keep doing it. And the important thing is to keep doing it. The other thing about type of exercise, when I say exercise, you might have something very specific in your mind about what that means. But there are lots of different physical activities that can kind of count as exercise. So doing certain recreational activities like gardening that causes a physical challenge might still count as exercise. So don't think you have to go to the gym and pound away on the treadmill to be doing exercise. So when we talk about type, there are 4 types of fitness, and your exercise program should include all of these 4 types of fitness. The first is cardiorespiratory fitness. So this is the ability for your heart and lungs to get oxygen to your muscles, and oxygen is what your muscles need in order to work. So doing any exercise that increases your heart rate and increases your breathing rate will increase your cardiorespiratory fitness. Strength is the ability for your muscles to produce force. So doing resistance exercises, using weights, or using your own body weight as resistance, or elastic bands, which we'll show you later, will improve your strength. Flexibility is the range of motion in your joints. You can improve your flexibility by stretching your muscles. And then neuromotor function is this sort of large concept of a thing that includes lots of things like agility and coordination. So if you were an elite athlete doing some kind of sports, then learning or practicing sports skills would kind of come under neuromotor function. But balance is also something that comes under neuromotor function, something that we all need, something that's very important for falls prevention. So I'm going to ignore the rest of neuromotor function and just talk about balance for the rest of the talk. So if you get nothing else away from this presentation, I want you to think about this slide and think about the different types of exercise and different types of fitness. Because a lot of people, when they think about exercise, they either think about cardiorespiratory or they think about strength. Very few people think about all 4. So it's important to have this holistic exercise program that includes all 4 types of fitness in order to improve your health overall. And if you're interested in preventing falls, it's important to have balance training as part of it. So this is a lot of information right here. These are the recommendations that come from the American College of Sports Medicine, which is the main body throughout the world that provides recommendations for exercise for the general public. So this is what they recommend for maintaining health overall. So the frequency, intensity, and time of exercise depends on the type. So for cardio, you want to do this pretty much almost every day, at least 5 days a week. You can do moderate intensity exercise 5 days a week for at least 30 minutes each time, or vigorous intensity exercise 3 days a week for at least 20 minutes each time. So when we say moderate or vigorous, we think about this 10-point scale. So if you're if 0 on the scale means that you're resting, you're sitting, you're not doing anything, and 10 means that you're going at your absolute maximum capacity, then moderate would be about a 5 to 6 out of 10, and vigorous would be about a 7 to 8 out of 10. So you can either do moderate or vigorous, or a combination of the two. You don't have to do all of this. And for cardio, you should do at least 150 minutes per week in bouts of 10 minutes per day. So it's pretty easy to do 15 minutes of brisk walking in the morning, 15 minutes of brisk walking in the evening, 5 days a week. Done, that's your cardio. For resistance or strength exercises, you should do every second day, or no more than every second day, so 2 to 4 days per week. You need to give about 2 days in between resistance training to let your muscles rest and recover. The intensity should start light, so it should start, you should feel like it's less than a 5 out of 10. So that while you practice the technique and you feel that you get the technique down, and then you can increase the intensity to about a 5 or 8 out of 10, 5 to 7 out of 10. The time that you spend will depend on how many repetitions and how many sets you do and how many exercises. So you should do 8 to 10 exercises that exercise all of the major muscle groups. Every time you do one exercise, that's 1 repetition. So if you do that 10 times in a row, that's 10 repetitions. And every time you do those 10 times in a row, that's considered a set. So you should do 2 to 4 sets of 10 to 15 repetitions. For flexibility exercises, again, stretch every major muscle group. Hold each stretch for a total of 60 seconds, and that can be broken down into 15 or 30 seconds per time that you do it. And you stretch to the point of slight discomfort. You don't want to go too far into the stretch, and you want to ease into the stretch too. The other thing about flexibility is that you should only stretch when your muscles are warmed up. So it's a good idea to, after you do cardio, to do some flexibility exercises. And then, of course, balance exercises are most important for our talk today. We don't really know, researchers don't really know what intensity or how to gauge the intensity of balance exercises, but you should find that the exercise is somewhat challenging to you. You should do balance training at least 2 days a week and spend 20 to 30 minutes a day on balance exercises. And we'll show you some examples of resistance, flexibility, and balance training later. As you do your exercise routine and you get fitter and you get stronger, you'll notice that whatever you started with starts to feel easier. So you need to start to increase the difficulty. So you can either increase the frequency or the intensity or the time, one at a time. Don't try to increase two things at once, so that you progress and you start doing more as you get fitter. In terms of increasing the intensity, you're increasing the relative intensity. So if you're still looking at this 10-point scale, it should still feel like the 5 or the 6 out of 10 that you were doing before, but you're actually doing more work. So for example, if I start doing a bicep curl and I'm lifting 5 pounds and I feel like that's a 5 out of 10 for me, after I do that for a few weeks, it might start to feel like it's a 4 or 3 out of 10. So then I can increase the amount of weight to 7.5 pounds, and that might feel like a 5 out of 10 again. So that makes sense, right? So what I've told you about designing your exercise program, that might seem like a lot of stuff to do. But like I said, listen to your body, start slow, have it as a goal in your mind to meet those recommendations or to even exceed those recommendations, but don't try to do everything all at once. And you might still get a benefit from doing less than the recommended amount of exercise. It's also not necessarily that much exercise because you can combine different kinds of exercise. So in a minute, we'll do a demonstration of some home exercise programs that you can do that include flexibility, strength, and balance training. So you can combine all of that into one sort of 45-minute to an hour long session so that you're doing all of those types of exercise all at once. And the last thing that I'll say before we start the demo is that you know, everybody has bad days, everybody feels busy, everybody gets sick and has to take a break from their exercise routine. And if this is the case for you, don't stress about it. Don't throw your hands up in the air and say all is lost. You know, you get back to it whenever you can, ease back into it again, listen to your body, and just try your best, and you can do it. Okay, so you guys ready? So I'm gonna bring my volunteers on board. This is Jen, Ben, and Anthony. We're gonna start some music too. So put some music on when you do your exercise so that you feel more motivated, feel happier about it. So the 3 different exercise programs we're gonna do, these are programs that have been shown to prevent falls in older adults. So Jen's doing the chair-based program, which is for people who are a little bit lower functioning, not able to stand independently, they're kind of unsteady. The FAME exercise is what Ben is gonna do. These are for higher functioning people who just wanna incorporate some balance training into their day. And then the Otago exercise program, which Anthony is doing, are somewhere in between, for people somewhere in between. So to start off with, we need to warm up. So we'll do some marching on the spot. So this is to get the blood, you know, circulating around the body. Increase the heart rate so that you feel warmer. Jen is doing seated exercises, so she's not going to stand. She can still do this marching in the seated position. Sorry. And then after you do this for a couple of minutes and you feel warm, you can move on to sort of ankle mobility exercises. So this is pointing the toe forward so that you start to mobilize the joint, start to loosen up the joint a little bit more. So it's important to remember what we're showing you here is just demonstration of some of the exercises that are part of these programs. We don't have a lot of time to show the whole program, but we're just going to show some examples here of some of the exercises. You guys good? So then we can move on to resistance. So Jen and Ben are using the elastic bands, and you can pick these elastic bands up. Any sort of sporting goods store, a lot of home health stores will have them. The resistance is based on the color of the band, and then Anthony's using ankle weights. So the first exercise we're doing is really good for strengthening the muscles at the front of the thigh. The quadricep muscles, and this is a really important muscle for maintaining mobility. You guys good? So we're doing about 10 repetitions on each side, and then we're switching sides. I don't know how many you guys have done. The other thing to consider if you, after this presentation, you don't really know what to do exercise-wise, you can consult with a registered kinesiologist in Ontario or a physiotherapist in the rest of the world, or even in Ontario, and they can help to design an exercise program for you that suits your preferences and your abilities and your goals as well. So once we're done with the knee exercises, we can move on to the exercises that work on the hip abductors. So the abductors are a group of muscles at the side of your hip that abduct or move your leg out to the side. And these are really, really important muscles for balance. They're used a lot when you're standing on one leg to keep your trunk all in line. But also used a lot when you're walking to maintain stability just in walking. Ben's taking a little bit of time to get going, but that's okay. Okay, and then we'll move on to the important exercises, the balance exercises. Now, Jen's program, because it's a seated program, it doesn't include any really balance component. So she's going to keep doing resistance exercises. So she's going to do sit to stands that are working on her leg muscles. And Anthony here is holding on to the chair for stability during his exercise. But if you can kind of leave your hand off for a moment, then that's okay. You can use a sturdy dining room chair to have nearby to keep stability. But if it might also be helpful to use a kitchen counter or dining room table, something that's a lot more sturdy to hold on to or to keep nearby. So the next balance exercise is Anthony's going to stand on one foot. And Jen's going to keep doing her sit to stands. Ben's going to try not to kick people who are walking by. So yeah, if you can let go at all or like just hover your hand, you can do it, right? So that increases the challenge a little bit if you're able to, but just keep the hand sort of hovering nearby the support in case you need it. And then the last thing, we'll finish with some flexibility exercises. So the first exercise is stretching the back of the lower leg or the calf muscles. So this one looks a lot like the next one seated, but the difference is that you're not leaning forward and you're driving the heel into the ground so that you stretch the back of the calf. And Ben can do it standing. And then the last stretch is to stretch the hamstring muscles, which are at the back of the thigh. So for this one, you're going to lean forward so that you stretch those muscles at the back of the thigh. And Ben's doing the same thing. And hold each one for about 15 seconds, switch over for 15 seconds, and then keep switching back for a total of 60 seconds per side. And that concludes our presentation. Thanks very much. And thank our wonderful volunteers.
I was wondering if anyone in the public has a question for Avril. Any questions? No? Okay. Good job.
You got a question for these guys?
Oh, yeah.
Oh yeah, sorry, I forgot to mention that. Yes, we there's a link again in the description of the video to the home exercise programs that we talked about today. And as I said, there's a lot more than just the exercises that we demonstrated. Yeah, so that's where you can find that information. Or if you're not going to look at the video, just ask me where you can find it.
Great, thank you. Thanks for these very practical tips and yeah, information about exercise. Tomorrow, come back, we have Anton Trin coming to talk to us about walking and balance assessments that he conducts in different nursing homes. So he's going to tell us a little bit about how to measure balance in a portable way. So thank you for joining us, and I'll see you tomorrow. Oh, and there is a tour happening right after this in 5 minutes. So please stay for the tour.